This is directly removing inflammatory biomarkers from your bloodstream and directly reducing inflammation. You can see it, you can measure it. And so from there, if we provide your organs the milieu in which to thrive and you remove the inflammation, all your organs are going to get better, right? And so therefore, you're going to avoid chronic disease and reverse chronic disease as well.
Well, Darshan, it's so great to have you on the podcast. We've been friends for a long time, and I'm excited to talk to you about some of the most amazing advances in healthcare and longevity medicine that you are at the forefront of it. It's great to have you.
Dr. Hyman, I can't tell you.
Mark
is, I have tremendous respect for you because, I told you this story before, you kind of set off my journey into this new field of medicine. I started my career in Western medicine. And when I heard you speak, I think it's been over 12 years now, I heard you speak for the first time. You inspired my entire new journey. So it's an honor to be here, Dr. Hyman.
That's amazing.
It's a true honor.
That's amazing. You never know. You're going to speak a bunch of thousands of people in some audience and somebody gets like the light bulb goes off.
Yes.
So that's great. So, you were a traditional surgeon.
Right.
And you were, trained at Mayo and all the top institutions and you were, top of the game. Why did you shift gears and go into a different field, which is very different from what you were doing, which is, a chance to cut is a chance to cure, to,
right.
to heal with steel, right. To heal with what you're doing now.
Yeah. So, I think a few things happened at the same time in my life at that moment when I first heard you speak. One of them was being in the Western medical system for so long, I was getting really burnt out, not with surgery. I love doing surgery, but I was getting really burnt out seeing people never get better, right? And then you're always seeing them when they're at their end of their rope, they're seeking surgery to turn back years and years of accumulated damage in many different ways, all the different surgical procedures that we have. And you can only address these problems one patient at a time. And you just felt like not only were you on this treadmill where you could never really catch up, we were actually going in reverse. There were more people getting sick than we could ever operate on. Right? Yeah. And so it just felt like this was leading nowhere to me. Both me personally as a surgeon and a doctor, but also the entire system was just getting nowhere. In fact, things were getting worse and the problems were accumulating.
Yeah.
And then I saw, looking in the mirror, just working 12, 14 hours a day in the operating room, like I would wake up after 4 hours of sleep being completely stressed out as soon as I woke up in the morning because I had to get to the operating room by 6 a.m. for a 6:15 cut time, right?
Yeah.
And then I would basically stand there in the OR with minimal breaks for hours and hours, probably 12, 14 hours a day sometimes.
You had a Foley catheter in there?
As a surgeon, you're not allowed the catheter.
For those listening, that's a catheter you put inside your penis so you don't have to go to the bathroom.
Exactly.
And you put a little bag on your leg.
Sometimes you wish you had one of those.
Depends to go into the surgery.
Exactly. But like you're there for hours with your cortisol levels up to here and you're just eating whatever's in the nurse's lounge, usually a combination of like donuts and bagels, right?
All the pharmaceutical companies bring in all that crap, muffins, bagels, donuts.
Exactly,
right?
Exactly. And then, you're like drinking coffee in between every single case.
Coffee and sugar,
right?
That's what medicine runs on.
Exactly. So I found myself in my early 40s in the sickest possible state that I could be in. I had five different diagnoses, personally, yeah. I was 5 different diagnoses: uncontrolled hypertension, I had an autoimmune disease, I had diabetes, not even pre-diabetes anymore. I was diabetic on my hemoglobin A1C level, and I was on multiple medications, which then I saw my personal concierge physician, and expensive guy in Beverly Hills. And his solution was to put me on Prozac because I was depressed about all of this stuff.
Oh, yeah.
And all the
You're on 5 medications for chronic disease and you're depressed. Okay, I'll just give you Prozac.
That's exactly what happened.
Pill for every ill.
A pill for every ill, right? And so I was super sick, and I personally was not getting anywhere in the treadmill of my own health. And so I decided at that moment there has to be a better way. But as you know,
you were 40 going on 60.
Yeah, 40 going on like almost 70. It was crazy. I was getting like decrepit at 40. It was not good. And so I was at the end of my rope and I was looking for alternative methods and seeing what else was out there. And that's when I happened upon an IFM conference where I heard you speak for one of the
Yeah.
first times. It was either the IFM conference or it was this big event out in Phoenix that was going, or in Scottsdale where you were speaking as well. I saw you speak like a couple of times in a row, and
Yeah.
light bulb went off, like you said. Like, I need to address my own health from the root cause.
Yeah.
Yeah.
Amazing. That's quite a story. And
Yeah.
and now you're sitting here, no medications, no hypertension, no diabetes, right?
I mean,
Not on Prozac.
exactly. And what's great about it is not only do I not have diseases, but I feel incredible. Like
Yeah.
the vitality and the energy and just the drive and, what I see in the mirror, like I just feel great, you
Yeah.
know? And so that's it. For me, it was like, yeah, it's so great. I don't have all these diseases. I'm off all my medications, but also just being able to like wake up in the morning refreshed, attack a 12-hour workday, and then still feel great after that
Yeah.
and be happy. I mean, it's just,
great,
it's just
incredible.
monumental. It is.
Darshan, what you're talking about is something, it sounds like, oh, well, I got these diseases, then I got off them. And that's not something that happens in traditional medicine. These are one-way streets. As we're trained, these are progressive chronic diseases that we have to manage. We even have a whole term. We have chronic disease management systems. There's whole companies devoted to chronic disease management.
Right.
Managing your medication, managing your disease. Who wants to manage it? Why don't we get rid of it?
Well, the pharmaceutical companies want us to manage it.
Yeah, of
'cause it's
course.
subscription revenue for them, right?
But your own life story is just an example of how these things are not inevitable, how they can not only be prevented, but also reversed even after you have them.
Absolutely.
And so
Absolutely.
that journey of, seeing what was wrong with our healthcare system from the
Exactly.
inside out, and seeing how you were essentially a victim of our modern society and the food system and the medicine that we actually practice, which is really not focused on creating health, it's focused on treating disease. We have a sick care system, not a healthcare system, right?
Exactly.
And so you decided you wanted to create a healthcare system that was different, and you called it Next Health. And actually, we're sitting here in Next Health headquarters in West Hollywood, California, doing this podcast. And I'm about to go get a procedure, which we're going to talk about because you're so gracious to offer me this treatment, which I've had a number of times, called Plasmapheresis, which is essentially cleaning your blood like an oil filter. But you had this vision of something different, and Next Health was really the thing that got birthed out of what you saw was wrong with traditional healthcare and what your own personal challenges were and how to get better.
Exactly. And so during this time when I was transforming my own health, I was going to multiple different places all over Los Angeles, right? I was seeking out sauna therapy here. I was seeking out hyperbaric oxygen therapy at a different place. I was seeing like 3 different practitioners at different places to get the things that I needed to get myself healthy. And it just was very frustrating. And then what was incredible too is I was able to get myself healthy, even though I had to go to all these different places. And I saw myself getting healthier. Like, this stuff works. Like, you can get on a good nutrition, exercise, sleep program, and do a few things that most people now have access to that we didn't have access to. And you can get healthy really quickly, actually.
Yeah, it's quite amazing.
Right. It's quite amazing. It's like your body wants to be in a state of health, not in a state of disease. And so I was talking to my patients about this, because they were seeing the transformations that I was having, and I was telling them how to do it. And for the ones that could have the time and the energy to do this, they were getting healthy and avoiding surgery themselves.
Yeah.
And I saw myself like becoming an evangelist for functional medicine, becoming an evangelist for the nutrition, and like doing something opposite for our regular system. And I was like, you know what? There needs to be a place where people can go where this is the system. They don't not cobble it together all over the place, right? And so Next Health really came from the idea of, let me just make one place where we could basically hit the reset button on the healthcare system.
Yes.
Right?
And on people's personal health.
Exactly. I was like, you know what? The healthcare Western medical system, that's a massive monstrosity that it's going to take. We got ourselves into this after 5 decades. It's going to take 10 decades to unwind this.
Well, you and I are working on shortening that time.
Well, exactly. I said, let's just hit the reset button. Let's make a new place where we could start all over again. And that's what Next Health is. Like, we approach it completely differently. I remember like starting Next Health, I got together with my business partner and we got a whiteboard and we wrote down all the things wrong with traditional healthcare.
Yep.
And we wrote down, like, what is the 180 opposite? What is the exact opposite? People hate going to the doctor's office because it's like on the 10th floor of a building and you have to wait 8 hours and you're in this tiny, dingy waiting room. What's the opposite of that? let's make a beautiful space that inspires people to want to go and get their health in order and visit on a regular basis. Like you go to a doctor once a year, we want you to come in once a week.
It's like an Apple store instead of like going into a corner bodega, which is a mess, right?
Yeah, exactly. That's what people call us, the Apple store of wellness.
Yeah, exactly. So, yeah. And it is beautiful. I've been there and I've been treated there. And this approach you take is really trying to put together some of the innovative therapies that have been sort of marginalized in healthcare, that often have been studied and have been researched, but are still neglected and often ignored by traditional healthcare. Whether it's just intravenous nutrition with IVs, or whether it's more advanced treatments like ozone or peptides or exosomes or plasmapheresis or hyperbaric oxygen. There's so much out there. I wrote a lot about this in my book, Young Forever, because these are the things that seem to be really affecting the trajectory of our biological health.
Yeah.
And one of the things that we're both focused on is how do we understand the science of aging? Because aging itself is not the problem, growing older. It's the biological aging that's the problem. And you can reverse that. And a lot of the therapies that you do and that you built within Next Health are the therapies that actually help to do that. And I've been on this personal journey myself. I never had all those diseases. I had different diseases. I didn't have lifestyle diseases. I had mercury poisoning and mold exposure, and I had C. diff from an antibiotic that I took, and I had colitis, and I had just one thing after the other. Lyme disease, babesia. I don't know why. I think I got all these things so I could figure this whole mess of medicine out personally, because I had to re-engineer myself from the inside out. I had to reverse engineer, what is health? How do I create that? A lot of these therapies are really important, and we're going to talk about them because they actually provide a pathway to change, not only improve your health, but to actually reverse this phenomena that is at the root of all chronic age-related diseases: heart disease, diabetes, cancer, Alzheimer's. And some of these studies have more research or less research. But the problem with a lot of these therapies is there ain't no money going into researching these, right? There's literally, have you been paying attention to the amount of money and research being published on the GLP-1 agonists, the Ozempics and Wegovy's and Mounjaros, the amount of money. They're studying it for everything. If you have a pimple, they're going to use it. If you have depression, they're going to use it. If they have, you have autoimmune disease, they're going to use it. Whatever they can think of, they're going to try to, and they're spending literally hundreds of millions of dollars, I'm guessing, on this research.
Right.
But nobody's spending hundreds of millions of dollars to really look at these other things. There's a few places like Altos Labs and Sam Altman founded a lab, but there's a lot of billionaires like the Google folks with Calico and Jeff Bezos with Altos and Sam Altman's initiative, where they're looking at a lot of these things. They're looking at plasmapheresis. They're looking at various therapies that we're doing. But it's really only the billionaires that are funding some of this now, not the NIH, which should be studying this. And it's so unfortunate because these therapies really have a profound effect. And I've been doing them for the last few years as I've been learning more about them. And I did my biological age when I started 2 years ago. I don't know if I told you this. I was 43, which was pretty good. I was 62 at the time. I did all this stuff that we're going to be talking about in a few minutes. And over the last 2 years, I've gotten 4 years younger. Even though I've gotten 2 years older chronologically, I got 4 years younger.
That's
so now
awesome.
I'm 39.
That's incredible.
So I don't know if I'm going to hit my 20s, but I'm going to still keep going and see how far I can get. And the point of this is not to brag. The point of this is to sort of explain that the things that we think are inevitable as we age are not.
Exactly.
And so why don't we sort of dive into some of the options and therapies that are available out there. And I want to start with plasmapheresis, because I think it's a really important innovative therapy. It's been around in medicine for decades for treating various kinds of diseases that are autoimmune diseases or neurologic diseases, and it's very effective for those conditions. But it's only done in academic centers. It's only done for very, very rare cases. It's not part of traditional medicine. It's not reimbursed for general health. And yet there's incredible research on it around Alzheimer's, around long COVID, around longevity itself. So first, why don't you explain what was the origin of the science that kind of began to let us think about this particular medical procedure as a potential treatment for aging itself?
Absolutely. So let's take the story way back to just even the ancient Romans, they were using a technology that they called bloodletting, right? Because they believed a lot of the bad stuff that causes some disease lives in the blood, and bloodletting, removing some of this blood, would minimize some of the symptoms of disease. And as we all know, this didn't really work or pan out because there's other things in blood that you really need. Exactly.
Although leeches have had a comeback in medicine for wound healing.
Leeches are having a comeback.
Because you put them on wounds that don't heal and it makes new blood vessels.
It does. It does. We use leeches a lot in surgery, actually. It's venous congestion and things. So I'm very familiar with leeches, but we're not talking leeches.
But you're not doing trepanation. You're not drilling holes in people's brains to let out the bad humors.
No. So fast forward, apheresis was a technology that was developed to treat a disease called Waldenstrom's disease, where you have immune complexes that make the blood too thick, and that thickening of the blood causes blockages in your blood vessels, and people would die from this traditionally. And then some very smart scientists in IBM, I think, figured out how to actually separate the plasma from the blood cells. And
what is plasma?
So plasma is the fluid portion of your blood. It's 45% of your blood. And if you've ever seen someone do PRP, which is take some blood in a test tube and they put it in a centrifuge and they spin it down, the blood will separate to a white layer on the top of the test tube and a red layer on the bottom. The red layer is your red blood cells and the white layer is your plasma on top. And there's like a little...
But the red, it's also your white cells, all your cells.
Right.
So basically you're separate. It's the soup in which all of your cells in your blood flow around. So it's like the red cells, the white cells, the platelets. You take those out.
Exactly.
And you separate that from the soup. And this soup, what's in this soup?
So the soup is where all of the...
In other words, what's in the plasma?
Yeah, exactly. What's in the plasma, right? So this is where all your cells are living, and this is what they're exposed to on a day-to-day basis. It's the growth factors, it is cell signaling molecules, it's nutrients, it's a lot of the factors of your immune system live in this soup. So it's basically where all the signaling in your body kind of lives inside of this plasma. And what's good about it is that it carries these signals throughout your entire body. So if you have something going on in your gut, your brain can hear about it. If you have something going on in your heart, your gut hears about it.
So it's the communication superhighway.
Exactly. One of the functions it has is being a communication superhighway for your entire body.
And so there are all these molecules in there that are regulating all these things.
Exactly.
So why do we then want to kind of take out that plasma, throw it in the garbage, and put in a replacement fluid called albumin? Like why?
Exactly.
Like why? What's bad in there? Because what you just said sounds good.
Right. Exactly. So let's take it back a little bit more also to the convoys with the parabiosis experiment. I think that's interesting to talk about, where they hook up a young mouse to an old mouse, and they found that the old mouse got younger and the young mouse got older. And so for a decade, people were looking for like, what is the substance in the young mouse that makes the old mouse younger?
Yeah.
And so they did all these studies and substances like GDF11, TNF, and nothing really panned out. And then 10 years later, there's a story. I think it's a true story, but I hear it all because I hear it all the time. Someone at a conference went up to ask a question to the scientist doing all the research on this, and they kind of knocked on the microphone and they said, I think you guys are looking at the wrong mouse. It's not what's in the old mouse. It's not what's in the young mouse making the old mouse younger. It's the opposite. It's what you're taking out of the old mouse.
Yeah.
So it turns out in our plasma is also where all the cytokines and all the signaling molecules that lead to inflammation accumulate, right? It turns out that's where all of the toxins that we're exposed to also accumulate.
Yeah.
It turns out where senescent cells, the SASP, the negative products that senescent cells secrete also live in our
zombie
plasma.
cells, which are part of the hallmarks of aging, which are essentially these phenomena that happen, these cells that don't die but just become zombie cells that then secrete all these inflammatory molecules that make us age faster.
Exactly. So if you look at all the root causes of aging, most of the molecules that signal the root causes of aging live in our plasma, from inflammation to toxin buildup to senescent cells. All of that is
damaged proteins.
In our plasma, right?
Because one of the other things with
damaged proteins.
One of the other hallmarks of aging is damaged proteins.
Exactly.
And so all these damaged proteins just float around and they create more problems, more inflammation, more dysfunction, and we sort of degrade, and our resilience decreases, and we age faster biologically.
Exactly. So it goes to reason from there that if this is all living in your plasma and your body is unable to eliminate this with its own elimination mechanisms, what if we just remove the plasma? And so some very smart people started doing experiments using a technology that's been in hospitals for literally 5 or 6 decades.
Yeah.
It's FDA approved. We've been using it, like you said, forever.
Yeah, I've been a doctor for 41 years, so like I know I'm old, but I remember it even back then.
Right. You use it a lot, and even for like drug overdoses, because you know that lives in your plasma too. Yeah. And it works, as FDA approved, is super safe. We've been using it forever, and this just highlights there's so much incredible technology locked up in the sick care system that if we just bring it back 30, 40 years, like you can eliminate chronic disease. Yeah. And this is one of those technologies. Yeah. So the treatment, like you've experienced it, is super comfortable. You just basically sit there with an IV in your arm and your blood is removed like about 200 cc's at a time. So it's a small volume, put through this giant centrifuge. The plasma is separated from the red blood cells. Red blood cells go back into you through the same IV or a different IV. And then you get a big bag of plasma that's basically thrown away. And inside of that, we've basically eliminated one entire plasma volume of all of these negative factors that have been built up over time.
So do you then throw the stuff out? And has anybody actually studied what's in there?
People are,
like when you get the stuff in, like it's like when you get an oil change your car, you throw out the old oil. Right. What's in that?
It's the same things that you measure when you do a blood test. Like, with the Function Health blood test, you get a lot of biomarkers and blood results basically back. And you're basically measuring those whenever you do a blood test. It's the same stuff, but you're just totally removing it and you're throwing it away. Right. And so I think people haven't really looked exactly like at the discarded plasma. People are looking at it right now.
It'd be fascinating to do. Like, what are the toxins in there? What are the immune cells, cytokines? What are the senescent cells in there? What's going on that we're taking out?
Yeah, and basically it's all being removed. Exactly. And so we've actually done a lot of patients now, and we've measured their total toxicity levels in their urine, all the toxins. We measure things like mycotoxins. We measure exposure to heavy metals. Yeah. We're measuring exposure to even like microplastics and all of these toxins. And we've seen significant reductions in before and after treatment toxin levels. So we know toxins are in the plasma. Yeah. And when you remove them, your body gets a chance to catch up, right? Yeah. Now it's able to say, whew, I've lost a lot of the stuff I'm working overtime to remove, and it gets a chance to clean up. And like you said, it's like an oil change for the body. Like, for all of us that have had cars forever, we know that if you don't do an oil change every 3,000 to 5,000 miles, your car's not going to run as well. Well, your body's the exact same way.
Yeah. It's interesting. I read a study recently that came out of Germany where they used plasmapheresis for long COVID.
Absolutely.
And what was interesting was they looked at a lot of people who have long COVID have autoantibodies against their autonomic nervous system, which is regulates all the things that are sort of automatic in your body, all the parasympathetic, sympathetic nervous system. And it basically affects your blood vessels in many ways and your blood pressure regulation. And a lot of people have, with long COVID, they have what they call POTS, which is, they get postural hypotension, they stand up, they get dizzy, they have all these other cognitive symptoms. There's all these other cytokine markers and antibodies. And they were able to actually measure them before and after the plasmapheresis, and it showed significant reduction or elimination of these and improvement clinically in these patients with long COVID. And the stats are always variable about how many people have long COVID, but it's probably 5 to 10% of people had COVID. And I think it might be more. I mean, if you think how many hundreds of millions of Americans had COVID, you take 10% of that, it's still 20 million people,
A lot of people don't even know they have it.
And it's like little brain fog, not feeling as good, just not as good as they were before COVID. And what's even more frightening is I was talking to Jeremy Nicholson, who's been on the podcast, who's a phenomic researcher from Australia, who's doing deep phenomics, which means looking at all these, not just the regular blood tests, but metabolomics and cytokines and thousands of proteins and molecules. And he says everybody who's had COVID has something going on. Like they're all a little out of whack in terms of their immune system, inflammatory system. Like my wife says, I never used to get sick. Now I get sick more because I have COVID. So, I think plasmapheresis is a fascinating treatment for that. And I think has a lot of promise.
Yeah. I can tell you a couple stories of patients that I've seen with long COVID. I had one guy that was coming to us with tinnitus in his ear, and he was at his wit's end. And as you and I both know, some people, when they suffer with tinnitus, depending on how severe it is, it
It's
can be
like ringing in the
severely,
ears.
yeah, the ringing in the ears, severely, even just mentally debilitating. I mean, people end up, just at home, not able to do anything with this. And so we had a
I heard even
patient.
people committing suicide as a result.
So I wasn't going to say it, but yeah, you're right. Absolutely, there is a suicide rate associated with tinnitus that is not, it's more than the normal population for sure.
Yeah.
And so we had a patient with this, and he was suffering with it for about a year. 2 treatments, and his tinnitus went away.
Amazing. It's
Went
incredible.
away. Exactly. And so he's still in the treatment process right now. It remains to be seen.
Was this post-COVID or was this?
This is long COVID.
COVID.
Post-COVID, long COVID symptom tinnitus, right? And so we're still in the treatment process. We're going to see how long it stays away. We're trying to expand between plasma exchanges for him. I'll tell you a story about me. So when I had COVID, for about 6 months after having COVID and getting it treated, my heart rate variability was down in the dumps, which happens to a lot of people with long COVID.
Yeah.
But my heart rate consistently elevated
Stayed elevated,
all night long. Right.
Yeah.
Exactly. Heart rate variability really down, and my regular resting heart rate was very elevated.
Yeah.
And then I started doing plasma exchange just to test it on myself and have the nurses practice on me really.
Yeah.
And complete change around. And most people will see their heart rate variability improve. And especially if you have long COVID, if you're suffering with heart rate elevation, you'll see that improve as
So
well.
heart rate variability, for those of you listening, don't know what he's talking about. It's basically the complexity of your heart rate, which is a sign of the resilience of your cardiovascular system and your nervous system. So when you're highly stressed, your heart rate variability goes down. So you want more complexity in your heart rate, more complexity in your health means more resilience, more redundancy. It's like a rainforest, which has got redundancy and complexity versus a monocrop cornfield, which is, if you have one bug or one blight or something, it's done. So this is really important measurement around your overall well-being and health. And that's a profound thing. I also have personally had an experience with COVID, and I didn't get to long COVID, thank God. But I had a severe case of COVID. That was my 3rd time in getting it. And my hand just swelled up. I got severe arthritis 2 weeks after. I'm like, this is terrible. And it happened to be in a place where I could get plasmapheresis. And literally within hours,
incredible, right?
it was getting better. And the next morning, it was completely gone.
Yeah.
Just never came back.
Yep.
And I was like, damn.
This is incredible. And like with the heart rate variability, like you had mentioned earlier, COVID makes antibodies to your autonomic nervous system. And
That's right.
If you have antibodies to your autonomic nervous system, your heart rate can't be variable.
That's right.
And so this is the mechanism by how this stuff works. And, I think there's always a tendency when we talk about like novel therapies like this to think that it's woo-woo and it's not really proven. But what I can say about plasma exchange is it really goes back to the fundamentals of medicine, right? Like we know why people get into a disease state. It's inflammation is one of the root causes of disease.
Yeah.
This is directly removing inflammatory biomarkers from your bloodstream and directly reducing inflammation. You can see it, you can measure it.
Yeah.
And so from there, if we provide your organs the milieu in which to thrive and you remove the inflammation, all your organs are going to get better, right? And so therefore, you're going to avoid chronic disease and reverse chronic disease as well. And we see that with Alzheimer's too.
Yeah. I think I'm just going to highlight what you said because it's so important. Inflammation is something people have heard about. It's in the news now. I mean, we've been talking about it in functional medicine for 30, 40 years, but it turns out it's the sort of final common pathway for aging and almost all age-related diseases. In fact, they're calling aging inflammaging, right? Heart disease is an inflammatory disease. Cancer is an inflammatory disease. I mean, I literally had a patient recently who had Hodgkin's lymphoma. And one of the ways that I figured it out was, he was having certain symptoms and we checked his blood levels of inflammation and they were extremely high. I'm like, something's going on here. And cancer, heart disease, diabetes, obesity, Alzheimer's, all inflammatory diseases. And not just that, but obviously all the other inflammatory diseases we have, the autoimmune diseases. Mental health is an inflammatory disease of the brain.
Right.
Depression, OCD, bipolar disease, schizophrenia, mental health that we think is psychological is often biological. And we miss that. And I wrote a book about this 15 years ago called The Ultramind Solution about how the body affects the brain.
Yes.
And so what we're talking about here is this underlying process of inflammation that cuts across all diseases, and it's one of the hallmarks of aging. So this technology of plasmapheresis seems to be an incredible way to help reduce the body's inflammation. Now, of course, you have to do all the other stuff, right? You're not just saying eat your McDonald's and come in and get your blood cleaned, right? And so you got to eat right, exercise, sleep enough, manage stress, take the right vitamins, and so forth. But as an adjunct, it's a very powerful tool for helping to reverse some of the phenomena that it causes all these age-related diseases, and it also helps you just feel better. I mean, I've done it a number of times, and you just feel like you get like a car wash, a brain wash. Your brain feels clear, you have more energy, you just feel lighter. It's quite an interesting experience, and you're like, what the hell is in my blood that's so crappy? That. And I think, I had it done a bunch of times, and the first few times, like my blood was like cloudy.
Yeah.
And then now it's like more clear. And you see that?
You could actually see it in the bag of plasma that we get. You could see how cloudy it is dependent about the number of things floating around in there, right? And especially if they have high lipid levels too, it gets really foamy. You can see that in the plasma as well.
Yeah. So you mentioned Alzheimer's and cardiovascular disease too. We'll talk about that. Let's talk about Alzheimer's, because some of the research on that is just so fascinating.
It's fascinating.
And here's a condition, just as background, where we spent billions of dollars, hundreds and hundreds of studies, no good outcomes. If there's drugs out there for Alzheimer's, they're either harmful or they might delay your entry into nursing home by a couple of months. That's a success. Not reversing it, not really slowing it dramatically. So there's really bupkis we've gotten. And yet now there's this treatment, which is extremely safe, which is relatively inexpensive compared to these Alzheimer's drugs that are out there that are cost, $50,000 a year or something.
Right.
And it's showing real promise, and not just to sort of slow it down, but to actually reverse it. So can you talk about the science that we now have around Alzheimer's and plasmapheresis?
Yeah, I mean, this is where I'm just so mind blown at how approaching a problem differently can make such a tremendous difference. And we know, Alzheimer's, more and more of us are suffering from Alzheimer's. There's research out there showing that up to a third of us will suffer from Alzheimer's in the next few decades. And it's just too high of a number.
And by the time you get to 85, it's almost 50%.
Yeah, exactly. It's just mind blowing. And so the way it works, well, we don't really know how it works. I think there's multiple different ways this is working. Number one is by reducing the baseline level of inflammation. Number two is by reducing the overall toxic burden to our brain. Number three is by actually removing some of these malformed proteins. So we can detect the amyloid protein, we can detect a tau protein in our blood now. There's actually blood tests we can use to detect
Yes,
this.
with Function Health, we're actually having something called AD Detect 4240, which is a marker of amyloid, and also p-tau 217, which is another important marker, and those actually change with lifestyle changes. And Richard Isaacson, who's been on the podcast, is really quite an amazing scientist, has shown actually reversing these blood biomarkers with reversing lifestyle changes, reversing the cognitive decline, and actually improving it. So you can now measure before and after, I'm imagining this plasmapheresis, what's going on.
Absolutely. And we're doing the study right now, measuring these before and after plasmapheresis. And I could tell you from my own personal experience, measuring my markers, I have almost 80% reduction in the post markers. Okay. Now that's biomarker change. There's also studies that have been done by Dr. Kiproff up in San Francisco, where he showed a 61% reduction in the rate of acceleration of Alzheimer's symptoms in Alzheimer's patients. So he's showing the actual clinical relevance, and we're seeing the biomarker relevance for using plasma exchange to treat Alzheimer's disease. And I think, I think that there still needs to be a lot more science done around this, but it's just mind-blowing to have a treatment that can cause this much of a reduction of symptoms without having to give a drug that could potentially have horrible side effects. Like some of the Alzheimer's drugs, you get brain bleeding, right?
Yeah.
And this has almost zero side effects.
Yeah, I mean, it's just a needle poke, basically.
Exactly, it's a needle poke.
Yeah, it's pretty amazing. And it's, so it's one of these treatments that has been around for a long time and having new applications, right? Long COVID, Alzheimer's. Now they're looking at it for something called lipoprotein a, which is a genetic lipid condition that puts you at high risk of having a heart attack, and for which there are no good drugs. So can you share some of the research about lipoprotein a?
Yes.
which, by the way, is something we measure with Function Health. And I literally just saw a patient this morning. She had 37 years old, she's healthy, looks relatively, good. I mean, she's not overweight. She's got no real issue, but she has a family history, and she had a really high lipoprotein little a. So I'm like thinking, oh, this is interesting. So how do you treat these?
Right. So, I love what Function Health is doing with measuring LP little a. Like, I can't tell you the number of patients I see that still go to their primary doctors and have never had an LP little a done before. And they're wondering why they have so much heart disease.
Yeah.
When up to 15 to 20% of people have the genetic malformation that causes LP little a. And LP little a, just for the listeners to know, is a particularly aggressive form of cholesterol that causes plaques in your arteries, but also can cause deposition of calcium on your blood valves. It can cause plaques in your arteries going to your brain. It's really dangerous. It can cause heart attacks quite easily and strokes quite easily as well, and valve damage. And so if you have LP little a, you want to get it treated.
Yeah.
Guess how you treat it? There's no treatment right now. There's no drug. Lifestyle changes. Actually, this is resistant to lifestyle changes.
I mean, some supplements I found lowering it like 20, 30%, but it doesn't go back to normal.
Yeah, nattokinase I think is good. And there's
kinase and cysteine, some other things we use. Yeah, but it's not easy.
It's not easy, right? People struggle with it. So we have 2 or 3 patients that we're treating with LP little a. Just like the toxins and the other things that we're talking about, all cholesterol also lives in your plasma, including the LP little a particles. And so this is removed in that bag of plasma that we're throwing away. And so what we're finding in these 2 particular patients is that their LP little a actually stays to close to normal levels for about 6 weeks after a plasma exchange, right? And so look, I think it's one of those therapies that as it becomes more ubiquitous, more people can use it for control of LP little a until we find a therapeutic that works. And there's a lot of research being done for therapeutics that works, but this is a great way to temporarily control this.
That sort of brings the question of, like you said, 6 weeks. Like for Alzheimer's, how often do you need to do it? Do you need once a day, once a week, once a month, once a year? Like what kind of frequency for, treating conditions that are more serious? And then what kind of frequency for aging itself? Is it once a month? Question. Is it every quarter? Is it I'm asking for a friend here, because I want to do it, and I want to know what do we know about this?
So I'll tell you what the research shows, and I'll tell you what I think. So the research that Dr. Kiprov did on Alzheimer's patient was a once-a-month treatment. He did that 6 treatments in a row for 6 months and measured various markers of symptoms before and after using the MoCA score. And
MoCA is a Montreal Cognitive Assessment Tool. It's basically a quick screening tool for your memory that we use to check for Alzheimer's.
Exactly, and use other tools as well.
It's not like a MoCA latte or anything.
Yeah, exactly. give a patient a MoCA and see how they like it. So anyhow, he did it once a month for 6 treatments. Okay, now that worked for Alzheimer's. What we're seeing in our clinic is probably about the same. Once every 4 to 6 weeks is what we're tracking biomarkers. So we're seeing biomarkers change right after the treatment and changes lasting for 6 weeks. And then some patients, not all patients, the biomarkers start reverting, okay? And a lot of this has to do with each individual patient's lifestyle. It's the lifestyle, their level of exposure to things like ultra-processed food, lack of sleep, all inflammatory lifestyles. And so it really goes patient to patient. And so what I'm a huge advocate of is this whole concept of N of 1, right? I don't think there's one particular protocol that applies to everybody. Every patient's an individual biology and psychology, and we need to custom tailor the protocol for each individual patient. So that's kind of where I end up with it. There's a lot of research being done for Alzheimer's and for age-related diseases as well. Okay.
So just as a regular monthly cleanup.
Well, I don't think it's monthly for everybody. I think that
because I'm way behind if that's the case.
Age-related, I would say, is probably going to end up being quarterly.
Okay.
But once again, it needs to be customized to you, right? So I think for you, if we were to measure your biomarkers, because you live an incredibly healthy lifestyle, of course.
I try a little too much travel and stress, but yeah, I try.
My guess would be for you is once every 4 to 6 months, actually. And so we just have to see where your biomarkers are. With our function labs, you can tell me when you're ready.
Well, that's another question is, are there unique biomarkers that can be tracked that are specific to the benefits you see from plasmapheresis? Right. In other words, should you have this panel of 10 biomarkers that tell you, before and after, this is what's changing? Like the, AD detect 4240 or the p-tau or cytokines or lipids, or what are the things that we should be actually measuring on a consistent basis before and after, so we can scientifically track what's happening?
Right. So,
or do we not know?
We do know. It's all the biomarkers that we're testing, like with Function Health, for example, for your biomarker panel, and it depends on what you're targeting. Okay, so for example, I have a patient with extremely high HSCRP, and a lot of it is due to gut health issues, right?
Yeah.
And so, one plasmapheresis, and her HSCRP went from 9 to 2.
Wow.
Okay, so for her, we're tracking HSCRP.
Yeah.
I have another patient that we're tracking mercury levels. This person has been struggling with mercury toxicity for literally a decade, has not found anything to
You mean
get it
chelation?
better. Even chelation. Chelation did not work. EBO treatments did not work. Sought out all kinds of alternative therapies.
EBO is ozone therapy,
Which
you also do at Next Health, right?
Yes, we also do ozone as well. So for her, we're tracking toxin levels, okay? And so like the LP-little-a patient I told you about, we're tracking LP-little-a levels. What's really incredible about this technology is it addresses so many different factors of poor health and also aging. Some of the research is being done around tracking markers of senescent cells for aging.
Zombie cells.
Zombie cells, right, exactly.
So there's no really commercial test for zombie cells,
not yet,
but it's research.
Right? Exactly, right? Yep. We're also tracking mitochondrial health now as well. We just found some new panels to track mitochondrial health, so we'll be tracking that. For people that are experiencing mild cognitive impairment or symptoms of Alzheimer's or even Parkinson's, we're measuring the beta tau protein and other biomarkers of neurodegenerative disease, and we're tracking those, right?
Yeah, I mean p-tau and beta amyloid, yeah.
P-tau and beta amyloid, sorry. Yes, exactly. And so we're tracking those. We're tracking based on what we're going after, we're tracking those biomarkers individually for
Interesting,
people.
yeah. So it's customized.
It's customized.
It's fascinating. And you know, this is not really accessible very many places, though. That's the problem, right? It's hard to find places where you can get this that are not part of an academic medical center.
Exactly.
And they won't do it for off-label reasons. You can't just go and say, hey, I want to get my blood cleaned. And they're like, sure, come on, let's hook you up. They're like, forget about it. You know, healthcare is not going to do this for you. Yeah. Even hyperbaric oxygen is like that. If you want to go,
exactly,
and it's unfortunate, but these are therapies that have a lot of science behind them, but that are only reimbursed for certain indications.
Exactly,
and so it's not widespread, and there's not a lot of clinics. And Next Health is one of the few places where you can actually get plasmapheresis.
Yeah. So, you know, when I worked at the Mayo Clinic, we had literally, I think we had like 36 plasmapheresis machines in the entire Mayo system. I mean, that's a lot of plasmapheresis machines just sitting there doing nothing, right? We also had 10 hyperbaric chambers sitting there doing nothing a lot of the times too. And it's like, why is this stuff just sitting here? This can be used for aging-related diseases and preventing disease. And so, look, these machines, they're everywhere, but they're not being used outside the Western medicine system. And even if you ask a hospital to let you do plasmapheresis, they wouldn't even know where to start because they don't know how to build the insurance for it, right? And so I think it's really important. What we're trying to do at Next Health is all of our locations will have a plasmapheresis machine, so anyone can come in and do it basically with an appointment with one of our doctors. And I think more and more centers are going to start doing this once.
And I'm going right after this podcast to go get one.
Yes. And you know, you've had it done before. You know it's very comfortable. You know it's very safe. You know, there's one more thing we should probably talk about with plasmapheresis. Yeah. It's that that's the use of albumin.
Yeah. I want to talk about that because, you know, before we get into that, albumin is what you actually put back in once you take out the plasma. It's the main protein in your blood. And there are health benefits to it, which seem also really interesting. I want to talk about that. Before I get to that, how much of the plasma are you removing? Because you have about 5 liters of blood, and probably 1 liter of that's probably blood cells, and the rest of it's plasma. I'm just making this up, but I'm guessing that's about the amount.
It's about 45% of your blood is
okay,
plasma.
So 45%. Yeah. So a full cleaning would be what? 2 to 3 liters. 2 to 3 liters.
Yes.
And you remove all that, and then you just put back in albumin.
And fluid.
And fluid, like saline, right?
Well, and we also replenish all your micronutrients as well. So what we're doing is taking out the bad stuff, putting back in all the good stuff.
Oh, so you don't do normal plasmapheresis. You do like an upgrade.
Yes.
So you put in albumin plus you put in IV nutrients.
IV nutrients and nicotinamide riboside we put back in you as well, which your cells need. We're doing also glutathione. We're doing albumin, and some patients will use immune globulin as well, IVIG.
Amazing. So The amount you take out is about 3 liters.
Yes.
You put back in albumin. So can you talk about what is albumin? Why do we put it back in? And what health benefits does it have besides just reconstituting your blood?
Right, exactly. So, you and I have used albumin in the hospital since the beginning of residency training, right? So
That's
albumin
right.
is not like a novel compound. We've had it forever. And a lot of
Like
times
people are malnourished or
Right.
have low protein. Yeah.
low protein, even like trauma situations where people lost a lot of blood and you like get them volume right away. That's where I used it a lot as well. So albumin is basically a protein. It's a highly purified protein that our bodies normally make, and when it lives in the plasma. And so when you remove the plasma, you have to replace albumin because your body has what's called an oncotic pressure it needs to maintain. It needs to have protein in the blood so that the fluid doesn't leave your blood vessels and go into all your tissues. And that's why you have that protein there. And so you have to replace it, but there's a big side benefit to this because albumin is one of the most stickiest proteins out there. In our biology. And what it does is it goes throughout your body, sticking to toxins, malformed proteins, sticking to dead cellular material. And this is what actually brings all these materials from your tissues to your bloodstream so that your kidneys and your liver can eliminate it.
Mm-hmm.
Okay. And so by replacing fresh new albumin that doesn't have anything bound to it, now you have all these binding sites available for your body to further eliminate these toxins from your tissues.
Amazing. Well, if anybody listening out there and has a lot of money, we got to study this more because this is one of the most promising therapies I think that exists out there for longevity based on the data I'm seeing.
Right.
And I was talking to Eric Verdin the other day, who's the head of the Buck Institute on Aging, and they're very focused on this as a therapy. There's also Sam Altman's lab is also focused on this as well. So there's a lot of really interesting science going on around this. Not funded by academic medical centers, not funded by the NIH, but funded by a bunch of billionaires who don't want to die, which is great for us because we're getting the benefit of the science.
Exactly.
But it's unfortunate that traditional academia and the National Institute of Health, which should not be called that, it should be called the National Institute of Diseases.
Disease, right.
They don't study health at all.
Took the words out of my mouth.
Right. But, this is really tremendous research. And I personally benefited, you've benefited from it, and I see the benefits from my patients who can get it. Now, the challenge right now is it's not cheap because it's an expensive machine. The technology,
albumin's expensive.
The albumin is expensive. The products are expensive. So, do you see a world in which this comes down, in price? Because, for example, at Function, we figured out how to get $15,000 worth of labs for $499 a year, right? With twice a year testing. Is plasmapheresis going to be able to be done more inexpensively? Well, I mean, and what do we have to do to get it covered by insurance?
Yeah. So here's why it's expensive right now. Is albumin's expensive because there's just not enough of it out there right now, and so the other big problem with the therapy is it's hard to get the machines. The machines are super expensive, and the people that run it need to be highly specialized as well.
It's not just like an IV nurse sticks an IV in. You got to know what you're doing.
Exactly. It takes a lot of training. So all of these problems are solved with scale, right? The more machines that are out there, the more people that get trained, and the more of the albumin product that's available, the lower that drives the price. And that's exactly what we're working on at Next Health. We're expanding Next Health to all the states and also around the world. And each location, like my imperative is to have a plasmapheresis machine at every location. And we're going to drive down the price as quickly as we can, because I feel like it's probably going to be a mainstay of treatment for avoiding chronic disease and also reversing chronic disease. And I want to make it available to as many people as possible. And then we want to do the studies that show the insurance company how this saves lives and saves them money as well. And once we show them this is what you need to be doing, there's a world where insurance.
Yeah, if you get this once a quarter, you prevent all these chronic illnesses, right? And I think that's why I asked you the question about what are the metrics that you use to determine success, right? If we can measure proteins in the blood that are elevated when you have starting to progress towards Alzheimer's, and you can reduce those, and you can show that Alzheimer's is the most expensive disease out there in America because of the collateral damage on the cost of caregivers not being able to work and the cost of caring for these people long term. I mean, it's an incredible economic drain in society, and the number of people getting it is going up and up. But I'll also just point out that don't expect that you just get plasmapheresis and you're going to prevent Alzheimer's or retreat it. You know, there's some other data that needs to be talked about, which is, I think, really exciting is the finger trial, the pointer trial, which are large studies looking at aggressive lifestyle intervention and risk factor management, showing that not only we slow the progression, but that we reverse the disease itself. And Richard Isaacson, his work, who was at Cornell, now he's down in Florida, is also done tremendous work showing that we can use aggressive lifestyle and personalized care to actually do exactly what you were saying. It's not everybody gets the same treatment. It's really what's wrong with your particular biology and how do we correct that? And that's what functional medicine is. It's really identifying how to create personalized care that actually is preventive and that actually gets people down the trajectory from illness back to wellness.
Right, exactly. And, I want to just double click on that because it's so important. You should never sit in a plasmapheresis chair if you're not willing to first undergo aggressive lifestyle intervention concurrently with a treatment program, right? Because you're just chasing the tail. It's like putting horrible gasoline in your car and changing the oil later. And it's just like the car is getting worse and worse and you're just trying to keep up with oil changes. It's not going to work.
That's right.
You have to be committed to aggressive lifestyle intervention and learning what they are. So a commitment to education on what is real, wholesome, good food. What is ultra processed food? What does a good night of sleep really mean? What is...
I got 90 and 90 on my score last night. I was really happy.
Well, after your plasmapheresis, you're going to get even 100 probably tonight.
Oh, really? Oh, God, I've never gotten 100. Brian Johnson gets 100. I've never gotten 100. If I got 100, I'm going to give you $100.
Okay, there we go.
Or maybe more.
But yeah, I mean, I think a commitment to aggressive lifestyle intervention should be a part of any longevity protocol, but it's a requirement before you start doing things like plasmapheresis.
I think we're going to put in the show notes references to the studies, and the research on this, because we're not just talking about some wacky thing. We're talking about something that's being really well researched that has tremendous promise, that I personally benefit from, that my patients have benefited from, that I think is one of the most exciting longevity therapies out there.
Yeah. I'll send you a paper. I'll send you another paper that just came out. It's a preprint that just came out. It's not peer reviewed yet, but it's in peer review process, but I'll send it to you and you can maybe link it in the show notes too. Are you know the True Age omic testing that they do?
Yes.
They do the Symphony test, which is organ aging by system. What is your biological age? Plasmapheresis study with omic age and Symphony testing showing major reversal of these markers.
Yeah, I mean, like I said, I went 4 years backwards as I went 2 years forward, and I probably had four or five plasmapheresis treatments over the last 2 years. So I think, I don't know if that's what did it. I've done a bunch of other stuff too. I just threw the kitchen sink at it, but I wanted to see how far I could get. I feel good about myself, but I think the studies are going to just be more and more, and I think we're going to learn more and more. Yeah. Okay, so Next Health is really pioneering some of these therapies. It's offering things that were really not available. What are the other promising therapies that you guys offer at Next Health that are, I think, important to consider as we look at treating this chronic disease epidemic and also helping people optimize health and achieve a longer health span and a longer lifespan?
Yeah. So one of the things I try to focus on with my patients, in addition to the basics, nutrition, exercise, sleep, is using some of the natural stressors that are in our environment on a regular, consistent basis to push health in the right direction. So these are things like heat therapy, cold therapy, light therapy, and oxygen therapy through hyperbaric oxygen. So we have what we call the longevity circuit. And I really believe that,
like in a gym instead of like a circuit.
Exactly.
This is like
it's a longevity circuit, right? It's like circuit training, but at a cellular level.
Yeah.
And so I encourage my patients to think of health as not a once a year or once a month or once a quarter thing. It's a weekly thing. It's something that you have to make health a habit. So we have people come in to do the longevity circuit on a weekly basis, where they do the hyperbaric oxygen for about 45 minutes, a sauna for 20 to 30 minutes, and then cryotherapy and then light therapy as well. And so this gets people, it gets your mitochondria slightly stressed, which allows them to make new mitochondria and make energy more efficiently. When your cells, the mitochondria are the powerhouses of our cells, when they are functioning well, every cell gets to do its job better and you just become healthier and you reverse chronic disease. Yeah. So I think that's another mainstay of therapy that we do at Next Health.
Well, I just want to double click on that one too, because what you didn't say was that these are therapies that all fall under the category of something called hormesis.
Hormesis. Right.
Hormesis is a medical word. It sounds like a lot, but essentially it means a stress that doesn't kill you, that makes you stronger. And we're all familiar with it, right? fasting, we know, and calorie restriction is an incredible stress on the body,
Exactly.
but it actually makes you live longer. We look at the Holocaust survivors who were basically starving. They actually have incredible longevity, and it's not genetic. You look at certain data that you can animal studies, which is hard to do on humans, but a third of your diet is restricted in terms of calories. So you eat a third less calories, you live a third longer. For humans, that would be living to 120. Of course, you're going to be miserable, hungry, and don't have sex drive, and be too skinny. But there are ways to actually mimic that. Exercise is a form of hormesis because you're stressing your muscles, and then you get sore because you're tearing muscle fibers, but then they come back stronger.
Right.
So it's like build back better, right?
Right.
So
Exactly.
the idea is these are all therapies that are available to us that we can use to upregulate these pathways in our body that I call the longevity switches.
Exactly.
So I talk a lot about this in my book Young Forever, but the body has this built-in healing machine. Like it actually literally has a healing system, which when you cut your skin, how does your body heal? When you break a bone, how does your body heal? Well, it has a healing system, but we mess it up all the time. And the ways to activate this healing system is that regenerates, repairs, and renews our body is through some of these practices: hyperbaric oxygen therapy, ozone therapy, light therapy, red light therapy, and cold therapy, heat therapy. I definitely find that for me, if I do a sauna and a cold plunge every day, I just feel like $1 million.
It's the best thing.
It's my morning routine. I wake up, I work out, I do I might do hot and cold first, then I work out, and then depending on where I am, and it's just an incredible way to do it your day, but it actually has all these other benefits.
Yes. I do mine at night. I do a 30-minute sauna and then a cold plunge at night, and I just 100 sleep score.
Come on.
I'm telling you, try it at
I want to
night.
see. Give me your phone.
Okay. I'm going to show you. Where's my phone?
Show me after.
Yeah.
That's insane. Okay.
Yeah. I try it at night.
Okay, I want to try it.
So, I want to say one more thing for everyone listening is a lot of this stuff might not be available to you, or it might, there's not a lot of centers offering any of this all over the country yet, but they're coming. All of this stuff can be done for free very easily in your day-to-day life. Just going outside in the morning, first thing in the morning, exposing yourself, maybe with no shirt on, to the sunlight. You're getting your light therapy. You're getting some cold therapy if you live in a colder environment. Cold showers. All of this stuff is available to everybody.
Yeah, you can buy like a little sauna blanket, or you can buy these little fold-up saunas that you can like stick your head out of for very inexpensive. And then I have a bathtub I just filled with cold water. I mean, that's what I did for years. I had a steam put in my shower, which wasn't that expensive, and I've had it for 25 years. And have a bathtub filled with cold water, and I just go back and forth. And I've done that for years, and it's not that expensive to do that.
Right. And the plasma exchange kind of correlated to that too is another way to do this same kind of therapy, but at a much smaller dose, is by donating plasma. Just go donate plasma. They'll pay you to remove some of your plasma.
Amazing.
And then your body will make new plasma. Now that's at a much smaller volume, of course, because your body has to make new plasma, but it still works. If you're young and you're healthy, that's something to consider as
So
well.
it's kind of hacking the system a little bit, like giving the blood. Yeah.
Right.
That's a good one. Okay. So in your vision for healthcare, where do you see all this going? Because there's so much happening so fast right now in terms of what's happening on the margins of healthcare, like Next Health and Function Health, the company I co-founded, that are really trying to push healthcare in a different direction and are actually disintermediating a lot of the traditional healthcare systems, operational, ways that we kind of work, right? So where do you see all this going?
Okay. I thought about this a lot, and I think that we are at this incredible inflection point where we're actually going to develop two separate systems. You're going to have what is considered right now the healthcare system, which we know is more disease care, Western medicine system. That's going to be its own system treating the end result of all this chronic disease, right? And trauma and other.
Yeah, if you need surgery or whatever,
right?
fine.
And then there's going to be a health system. That's going to be developed by people like yourself, giving people the empowerment to manage their own biomarkers and take personal responsibility for them with Function Health, with places like Next Health, giving people a place to go to do some of these therapies and to talk about their health with practitioners. I think we're going to have a true health system. And then the current system will be a disease system.
Yeah.
And these will be in parallel, which is the way it all of it should have been done in the first place.
Interesting, yeah.
And that's what I'm really excited about. I'm not so negative about the health system because I think it has a function.
Of course.
And it needs to always be there. But we need to have dollars funnel towards health versus that disease care world.
Well, I mean, listen, all of us are going to have something. Like, for example, I have a genetic risk for atrial fib. My mother had it. Tall, thin guys who are athletes, when they're older, tend to get it. I got atrial fib. I needed heart surgery. Okay. Thank God they could map out my heart with electrophysiology and figure out which little place to zap. And now, a week later, I was playing tennis. Amazing. So that's amazing, right?
You need that.
I need that's great.
Right.
But there are so many things we do in healthcare that are just like trying to plug a hole in a sinking ship with your finger, and it's it's the size of a football field, and yet we got our finger trying to hold the dam together. It's not working. So we do need a true healthcare system, and I think what we have now, when people call it health insurance, we don't have health insurance.
No.
We have disease insurance.
Yeah.
And so I see Next Health and Function Health as true health insurance.
Exactly.
And yes, you have to pay out of pocket. But now with health savings accounts, so anybody can start a health savings account. So there's literally billions of dollars in health savings accounts. People are not using them properly. TrueMed is started by a friend of mine, Callie Means and Justin Meyer. They actually are now enabling you to be able to use your health savings account dollars for things like plasmapheresis, for things like ozone, or things like your vitamin supplements or hyperbaric oxygen therapy. So you can actually start to use pre-tax dollars for this. You can start your health savings account, and you have to invest in your own health, because if you don't pay now, you're going to pay later. I had this one patient, she was on $20,000 of copay at 66 years old for all the medication she needed for chronic illnesses that in 3 months were completely reversed. Diabetes, heart failure, hypertension, fatty liver, renal insufficiency, all gone. And as a doctor, you don't reverse heart failure.
No.
You manage
Right.
it. You don't get we call it ejection fraction, which is how much of the blood you pump out with each pump of your heart. It should be about 50%. When it goes down under 50, you're starting in trouble. This one was like 35%, went back up to 50. Yeah. You don't see that with traditional medicine, but when you use, and this was just lifestyle and diet, it wasn't even all these fancy things we're talking about. So I think we have the ability to really treat disease completely differently. And one of my kind of thorns in my side that I get always really irritated about is when people talk about prevention. Mm-hmm. They talk about lifestyle as prevention. I'm like, no, it's treatment.
Yeah.
And it works better than traditional medication. If I need a drug, I'm going to use it.
Right.
Like if there's a drug, certain patients have genetic lipid disorders. They might need medication like a PCSK9 inhibitor. They might need a statin. That's okay. But not 75% of the prescriptions being written for people for prevention with a statin that they don't even. I had a patient just today who had a doctor tell him he needed to be on a statin. There's a 54-year-old guy who had some abnormal lipids. They did a coronary angiogram with a CT scan, and they saw a little something that was in the circumflex artery, which is it was a narrowing, and it probably was just a kink or something.
Sure.
And they're like, oh, we need to put you on statins right away.
Oh my god.
And I'm like, wait a minute. Wait a minute. You're super healthy.
Right.
You eat perfectly. You exercise all the time. I don't think this is a problem. Let's do an AI heart scan on you.
Yep.
Right.
Right.
It's called Clearly Health.
Yep.
And you can look it up, clearlyhealth.com. There's centers all around the country where you can get this done. But you can get just a regular CT angiogram, which they do in any hospital, and you can just have your data read by this AI. He was zero. Like I don't think I've ever seen a 54-year-old like get zero. He had zero plaque, zero soft plaques, or hard plaques, or any kind of plaque. His arteries were pretty clean. I'm like, you do not need a drug, And so I think we really need to start looking at treating people really differently, and being very personalized, and doing deep biomarker analysis, deep phenomic analysis, and using therapies that are going to actually create health. Because none of the therapies that you offer, I would suggest, are disease treatments. They are health treatments. They're helping you elevate your health. And when you create health, disease goes away as a side effect.
Exactly.
So you don't have to treat the disease.
Right.
You're just creating health and removing the things that are impediments to health, right?
Very
All the
well
shit
said.
in your blood.
Very well
And
said.
you're
Yep.
adding the ingredients for health, right? The nutrients and vitamins and all the other stuff we talked about.
Exactly.
So it's really quite simple. You take out the bad stuff, you put in the good stuff. The body's healing
You've been
machine.
saying this for years.
Yeah, the body's healing machine actually just knows what the heck to do.
Exactly.
So
Yeah.
it's quite incredible. You're just such a beautiful man.
Thank you.
You have such an enthusiasm for making the world a better place. You're doing such great work. You're doing so many other things too. We didn't even get into, but I think everybody should learn about these therapies. We're going to put links in the show notes to them. We'll put a link to Next Health. You can check it out. Unfortunately, it's not in every town, in every city, in every corner, which it
Not
should
yet.
be.
It will
But
be.
I want this to be the Starbucks of health.
Yes.
You know, where you
That
can
would
get
be
in
awesome.
an airport, you can go wherever you want, and get this done. And I think we're going to change healthcare together. So thank you, buddy.
I appreciate it. I'm so glad to be on this journey with you, Mark, Dr. Hyman. And I really appreciate you giving me the opportunity to talk about this today.
Oh, that's exciting. It's very exciting. Well, till next time, we'll do this again. And I'm excited about my Plasmapheresis today. I'll tell you all how it works. And we'll see you next time on the Doctor's Pharmacy.
Let's do it. Thank you.
If you loved that last video, you're going to love the next one. Check it out here.